Hi, I'm Lebo Tshangela, and this is the 7th edition of the series Frontline Workers, where we talk to courageous essential workers who daily risk their lives to provide important services to the general public during the global COVID-19 pandemic. With the second month of lockdown coming to an end, the work of journalists has been crucial in keeping the nation informed ever since South Africa declared a national state of disaster. As essential services workers, the role of journalists has been applauded by the likes of Minister in the Presidency, Jackson Mthembu, who says their contribution goes a long way in reducing misinformation and the impact of fake news. On World Press Freedom Day, UNESCO said, in the context of the unprecedented public health crisis caused by COVID-19, access to verified and accurate information produced by independent media and fact-checkers could be a matter of life or death. Coming up in this edition of Frontline Workers.
There was so much fear. And I remember that one of the first stories that I covered was the confirmation of the positive cases of COVID-19 in Alex. A lot of people that we spoke to, some of the people who themselves also had tested positive, gave us the same feedback that they had so much guilt and they had so much anxiety. It was difficult for me because I thought to myself, I possibly could be the person that infects my family members. And we do understand the implications of us being essential workers and the threat or the possibility of exposure. And the only thing really that can be put in place to try and assist us is support structures.
SABC TV News journalist Nozintombi Miya tells me what she goes through as a frontline worker. As part of her field reporting role, she meets and speaks with sources and newsmakers from all walks of life. She tells me about her personal encounter with COVID-19 and how covering it nearly compromised hers and another colleague's health.
In the week before the lockdown, myself and my camera colleague were assigned to cover a story in Sebokeng where the nurses at one of the healthcare facilities complained to us that the doctor she worked with had tested positive. Her complaint was that this doctor who had tested positive, while she had disclosed her status of having tested positive for COVID-19 and had taken precautions to self-isolate, in the days leading up to her disclosing her status, she hadn't said anything to any of her colleagues, and she had worked closely with her colleagues, and she'd also worked with some of the community members. So the fear at that point by the nurses was that the doctor had inadvertently infected not just some of her colleagues, but also some of the staff members, and also some of the people who she assisted in the community. Therefore, they were concerned and they wanted their management to shut down the facility, to make sure that they scrub down the facility and make sure they put in all the proper hygiene protocols and scrub down the facility, while at the same time giving tests to those healthcare workers and tracing some of the community members who had been seen by the doctor in the days leading up to the doctor testing positive for COVID-19. And this didn't happen. And as a result, the health workers decided that they were going to go on strike and they were not going to render any services to the community member because they felt that they were at quite a high risk themselves and they felt that management was not giving them sufficient answers. Management's response at the time had been that they will wait for the quarantine self-isolation date of that particular doctor to expire and her PA who worked with her closely before they can give any further tests to those healthcare workers. And this obviously didn't go down well with those healthcare workers. That's why they contacted us as SABC to come and cover their story. We went there. We spoke to the lady. As we got there, she had on her mask. We, as the SABC News team, had already been conscientized to put on our masks, to sanitize. We'd been capacitated with sanitizer and with masks and with gloves. And due to the dynamic nature of the situation, myself and the camera colleague decided that before she got into the car, that we would sanitize the car and sanitize all the items that we would communicate with her before we do the interview, while we were still doing the pre-interview with her. She got into the car. She had a mask on. We sprayed her with the sanitizer, and she explained to us what happened. When we got back to the office, we indicated to our editors that the person that we had spoken to did not know her status. She had not been tested. She had done the preliminary tests of checking whether she was coughing, whether she had a temperature or a fever, and her overall health. And she was worried because she felt at the time that she was displaying several symptoms.
According to the World Health Organization, if you suspect that you have been exposed to someone with COVID-19, you should self-quarantine for 14 days, even if you don't show any symptoms. During self-quarantine, you should monitor yourself for symptoms daily. Nozintombi transitioned from storyteller to potentially being part of the story she was telling.
When we told management about what had happened, management advised us that it was best for us to self-isolate and to go and get tested. They told us that we needed to speak to wellness to get further clarity on what steps were needed for us to be able to schedule a test and for us to get social psycho assistance from wellness if it was something that we needed. Because you can imagine that at the time, in the very first week or in the days leading up to the first day of lockdown, there was a lot of anxiety. There was a lot of information that we didn't know that we know now. And tensions were at an all-time high because we were seeing the numbers of infection rates and death rates in European countries, in the United States. We saw the devastation that the virus wreaked in Italy, in Spain, in countries that were considered first world countries but were being completely destroyed, disseminated, crippled by the virus. And obviously our management was quite concerned and worried about this incident that we'd been exposed to, and they wanted to ensure that they took all precautions and make sure that we, as the crew that covered the story, were also safe and taken care of.
Health authorities recently reported shortages in the number of test kits available in the country. There's also excessive pressure on lab services, which has been plagued by massive backlogs. I asked Nozintombi about the process she had to go through in order to get tested for coronavirus.
There was a shortage of testing kits. There was a shortage of reactionary agents. So there was quite a shortage of tests. There was a lot of hysteria and a lot of people wanting to get the test done. So that's what we did. We went to the family doctor. We individually went to our individual family doctors to go get referral letters for the tests that we got done on Friday. And this was, I think, 3-4 days after we'd done the story, or after the story had aired. And we went down to the Lancet drive-through testing site that was down the road from the SABC. And when we got there, they were very friendly, they were very calm, and they explained everything to us, that they were going to take a swab from us, and the swab was going to be taken from the back of our throats. And they used a long cotton bud, I suppose you could call it a long cotton bud, to get the swab at the very back of the throat. And from there, they would then take the swab and they would take it to the laboratory, and they would give us back feedback within 5 working days or 7 days, basically. If you feel a tightening of your chest and you feel this dry cough that's just not going away, and you have a temperature that's skyrocketing, these are immediate warning signs. And they said they've actually encountered some people who actually came to the testing site who themselves had their throats had swelled up because they'd become so inflamed they couldn't breathe, their chests were completely tight, and obviously they then referred those immediately to the hospital.
Nozintombi says after they concluded with testing at Lancet, management and the internal SABC Wellness Center suggested they do a second test as a precaution. This based on the likelihood that the results could show a negative, considering that it takes several days before the virus shows any symptoms in the body.
For the second test that we did, which was now after full 7 days of initial exposure, when we did the second test, we managed to find another private laboratory because obviously the Lancet laboratory was still busy with our initial test that we did. So we decided that we were going to go to a different testing facility to try and make sure that we get the correct results and that there's no bias in the testing. We managed to get one of the doctors from Gift of the Givers. And this doctor at the Gift of the Givers referred us to a private testing site where they test everybody and they give you feedback within also 3 to 5 days. What was different with this is because we were getting tested by a medical doctor, he also gave us medication to strengthen our immune system and to help us if we felt that we had any symptoms of fever or body aches or pains. And he said to us, if at any point in the days before we got our results, we felt that we were not well, we should come immediately to him or we should phone him immediately and he would refer us to the nearest healthcare facility.
By the end of March, 2 SABC employees had tested positive for COVID-19. The first case had been in Kimberley and the other in Johannesburg. This made it all the more real for Nozintombi, who had to self-isolate.
About 5 days after the initial test that we got done at the Lancet laboratory, we got an email from Lancet saying that they had our test results and that we tested negative. 2 days after, we got a phone call from the independent doctor's office where we'd done the second test, saying that they had our results and that they wanted to email us the results. Then they emailed us the results. The results also came out negative. So this process took about 2 weeks. It was a 2-week process, basically, where both results luckily came within almost 2-3 days of each other, where both results were negative, which was a huge relief for us as colleagues because it was very difficult for us because we had been in self-isolation. And I think it was of great concern to management as well because it was really the first case study in the Joburg newsroom where we had this incident and we were still trying to find a way to deal with it and we're still grappling with a lot of unknowns. So the process that we took, it was very clear and it was helpful because we did everything step by step and we were able to give feedback to our colleagues and to management to say this is what happened.
According to the National Institute for Communicable Diseases, it's very likely for people who have contracted the virus to remain asymptomatic. It says negative tests largely depend on when the sample was taken, advising anyone who has even had secondary contact with the virus to self-isolate for at least 2 full weeks.
I think it was a little bit strange going through the testing because it hits you at that moment that you couldn't necessarily be a victim or somebody who contracts the COVID, but you could be the carrier. And I think that for me was one of the biggest concerns for me because we see a lot of people on a day-to-day basis on our stories. And not only that, if I was unwittingly a carrier of the COVID-19 virus, if myself and my colleague had unwittingly become carriers of the COVID, not only were we going to possibly expose our colleagues, the people that we were interacting with on a day-to-day basis out on stories, on locations, but our families. And it was a very difficult and unsettling time for us because not only were we in self-isolation and we had each other for company, which was great, but at the same time, we couldn't really interact with our families as we normally would because we were isolated to one. I know that in my house, I was isolated to one part of the house and I couldn't interact with my family. I had to make sure every time that I came back from wherever I went, I had to sanitize. I had to stand outside in the yard and take a hose pipe and sanitize with proper Dettol and whatever sanitizers before I got inside the garage, before I even got inside the house. And you know, it was difficult for me because I thought to myself, I possibly could be the person that infects my family members. And it didn't sit well with me because I could have unwittingly gotten infected and as a result become the carrier that infects my family. And honestly, not the best feeling in the world. And it galvanized me and it strengthened me to make sure that I took all the precautions before getting inside the house to ensure that I keep not just myself safe, but my family members safe. What was I going to say to my extended family that I had unwittingly infected my family as a result of being infected by somebody else? And these were questions that just kept going through my mind in the days leading up to the results of the first test and the results of the second test. And I think this is what a lot of people go through who end up getting symptoms and have to go get tested. The waiting period, I think, is probably more anxiety filled and nerve wracking than getting the results, because you're sitting there and you're thinking about so many things, how you could have taken better precautions, what you could have done, how your actions currently are keeping your loved ones around you safe. And I think that these are a lot of issues that have come out in the stories that we've done subsequently, that people who've gone and gotten tested, especially in the first 2-3 weeks of the lockdown and the virus spreading through the country, and we still didn't quite know a lot of information. We still didn't have a lot of data, and there was a lot of anxiety, and there was a lot of pressure on government to try and make sure that they get as much data as possible. And a lot of people that we spoke to, some of the people who themselves also had tested positive, gave us the same feedback, that they had so much guilt and they had so much anxiety. It was a nerve-wracking time for them because in the minute that you go get tested, you realize that you possibly could be the one that spreads the virus, and your mindset changes. You're no longer thinking of the virus as something that's far or removed from you, or happens in those communities, or happens to those people. I didn't travel, therefore I don't have access. I couldn't possibly have gotten the virus because I don't travel, or I take all precautions, therefore there's no way I could have gotten the virus at a mall or in a taxi space or in any other public space. It's true what they say. The virus doesn't travel, people travel. And this is how you get it. You get it because you're traveling. And the minute you go and get tested, you realize how much you have traveled. And you realize how you need to change your behavior to become more cautious.
The Health Professions Council of South Africa President Dr. Kgosi Letlape is of the view that South Africans are misbehaving and worsening the rate of COVID-19 infections in the country. Letlape says stopping the virus is a community response. It's about the hygiene measures, physical distancing, and to listen to what is pronounced. And if we comply, the lockdown levels will come down. Nozintombi shares her observation about compliance from her work on the field.
In our experiences out on stories, going to the malls and seeing shoppers' behaviors in the malls, the long queues, the lack of social distancing, the lack of people putting on masks, not just in the malls, but in suburbs where people are jogging in and they don't have masks on, or people are walking and they don't have masks, there's no social distancing. I've been extremely impressed when I've seen people in public transport spaces, especially taxis. Taxi drivers have got masks on. Taxi drivers have got sanitizers. Their passengers have got sanitizers. Their passengers have got masks. We're seeing that some sectors of society are adhering vehemently to the advice from government and from healthcare workers on how to take precautionary measures when traveling in public. But we're also seeing a large number of society members not adhering to this, and this is concerning. And the impact it's had on my career is to motivate me to do even more stories where we are telling the honest truth and the real stories of real people affected by this virus, impacted by this virus, whether it is somebody whose family member has tested positive and how that has impacted on them and how that has impacted on their family. These are the stories that we are determined to tell continuously. The stories of communities who want to protect themselves from the virus and are not quite sure how to do that. I've been so impressed when I go to informal settlements, some informal settlements, where you see community members wearing masks, community members wearing makeshift masks because they can't afford to buy masks, but they've got makeshift masks, where you see the children with the masks, where you see the adults with the mask, where you see a level of social distancing. There are people that are trying their best. We need to acknowledge that.
Besides the risk posed by the interactions they have with the communities every day, journalists are also contending with marginalization during the lockdown period. In April, an SABC News crew in Durban was harassed while out on the field reporting on the impact of the lockdown on rural communities, and was later blocked and threatened by a group of people. Last week, a Free State community newspaper journalist, Paul Ntoba, was allegedly assaulted by the police in Vicksburg while he was on a news gathering assignment focusing on the COVID-19 news coverage. I asked Nozintombi if she's faced such challenges.
With regards to the issue of the safety of journalists covering the virus, in the very beginning, in the first few weeks of the lockdown, there was so much anxiety, there was so much fear. And I remember that one of the first stories that I covered was the confirmation of the positive cases of COVID-19 in Alex. This usually vibrant and thriving community. Alex Township, it's got such a noise, it's got such a vibe. There's always a buzz, a hum of movement. There's always that level of excitement in the air every time you go to Alex Township. And when the news broke that there was a possibility that there were several people that had been infected in Alex Township, it was such a complete contrast because we spoke to some of the taxi drivers that were there, and they said, we're worried because we travel locally with these people, and the area that had been infected or that had been impacted on is called Stjoetla. And the taxi driver said that they travel up and down that route and they do take people from there to different parts of Alex, and they were concerned because at the time they didn't have face masks, they didn't have sanitizers, they didn't have gloves. And you could just sense that there was a lot of fear, there was a lot of anxiety, there was a lot of confusion. People didn't really know how to deal with, interpret, or express what exactly was going on. But I must say that I was really impressed the several times that we went to Alex, especially in the malls, where you saw that management in the malls, as well as community leaders, they took the initiative to make sure that there was social distancing. There was so much tape on the floor. I don't think I'd ever seen so much tape on the floor in any mall in the country, where you saw that the security guards were enforcing that people would stand 1 meter apart. Nobody would go in without sanitizing. They would sanitize people. At the time, we hadn't really had a lot of people wearing masks up until now, where you're seeing a lot more compliance with people wearing masks. But you could see that every person that got in was sprayed with a bit of sanitizer, and that to make sure that they stood 1 meter apart. And no more than 30 people could go in at a time. And the queues were snaking. The queues were absolutely ridiculous. But the willingness of people to comply with the rules and regulations really impressed me and heartened me and gave me motivation that regardless of how confusing a time this was and how anxiety filled the time was, there were communities out there that were willing to go the extra mile and have patience. Be patient that they would eventually get their turn to go and buy what they needed to buy, and understood the precautionary measures that were being taken. On the other hand, there were places that we went to in Alex where there was no social distancing and there were queues and queues of people that were standing one on top of the other and absolutely no precautions were being done. And this was really frustrating because on one hand, a lot is being done in a community that had confirmed cases of COVID-19.
Many South African journalists are in mourning after ENCA cameraman Lungile Tom died from COVID-19 related complications last week. According to the Global Investigative Journalism Network, the virus has claimed the lives of 64 journalists in 24 other countries. Nozintombi says a lot of media houses are taking as many precautions as possible to try to protect their journalists.
At the end of the day, we are essential workers and we do understand the implications of us being essential workers and the threat or the possibility of exposure. And the only thing really that can be put in place to try and assist us is support structures so that we know, if we are exposed to this virus, where do we go? Where do we turn to? Who do we speak to? Is there somebody who is there that can assist with giving guidance and explaining, walking us through the process of, okay, this is what you need to do, this is where you need to go, etc. And we did get that at the SABC. And it's so important that other media houses also put in all these measures, these support measures for people who are working on the ground. We do get inundated as well. The stories that we're hearing are extremely heartbreaking. They're extremely heart-wrenching because not only are people fighting against this invisible virus, but they're also fighting against hunger. They're also fighting against the fact that there are no jobs and they need to provide for their families. And as a journalist, having heard about the passing of the ENCA camera person, this really does not fill us with any happiness. It's really sad. These are the risks that we take every day as essential services workers. And his family, his friends, his colleagues, not just at the ENCA, but also in the entire media fraternity in South Africa, need that support to say, we understand as essential services workers, this is what you're going through and what support do you need.
For the next edition of Frontline Workers, you can visit sabcnews.com or at SABC News on Twitter, Facebook and YouTube. For SABC Digital News, I'm Lebo Tshangela.